Hello and welcome to the Terran Academy of Science. I am Dr. Parker, and through these courses, I will try to help you gain a scientific perspective on matters of health science, starting with the condition that we usually call addiction. These lessons will cover the fundamentals of addiction science, and will be numbered in the order that it is best to learn them, so that you will have a good foundation in the neuroscience necessary to understand why and how humans are susceptible to addiction. There is some resistance to the use of the term addiction today. The argument is that it has developed a negative connotation, and that we should use another term, like substance use disorder. We disagree. When we say the word addiction, everyone knows what we are talking about, even if hardly any two people agree completely on the definition. Substance use disorder, on the other hand, covers a spectrum of behaviors, many of which do not meet the diagnostic criteria for addiction. This has caused a lot of confusion in both the medical, scientific, and law enforcement communities, as persons not trained in addiction science will often mistake a symptom for the disease. Going into an ER and asking for hydrocodone can be considered drug-seeking behavior if you have no pain and are lying to get the medication. It can also, however, be a perfectly normal thing for someone to do if they have been on this medication for chronic pain for a long time and left their medication behind while traveling. Again, a symptom of a disease should not be confused with the disease. Here we will define addiction as the continued, uncontrolled use of a substance or activity for the purpose of experiencing a sensation of euphoria, resulting in overexpression of the gene delta phos-B in the nucleus accumbens of the brain. To fully understand what this means, we need to take these concepts apart and study them in depth. We prefer this definition over others, because while almost all of us have developed opinions on what we think addiction is, most of us are wrong, even physicians and narcotics agents. We often use the term freely when describing other people, when it may not really apply. He's addicted to video games, she's addicted to exercise. We apply it less often to our own actions. And that brings us to an important point. What is the difference between a habit, a compulsion, and addiction? To understand this question, we must first understand some basic parts of the brain and how they work together to create feelings of desire, urges, compulsions, and addictive behaviors. 100 series lessons will cover the neuroanatomy you must know to understand addiction. 200 series lessons will cover behavioral neuroscience. This will focus on how the structure of the brain produces behavior and thought. 300 series lessons will focus on neuropsychopathology, the study of what happens when things go wrong in this very complex system. 400 series lessons will focus on the latest non-prescription treatment modalities for addiction, as well as educating you on medications that your healthcare provider might use for this condition. 500 series lessons will be discussions on the future and philosophy of addiction treatment, including such topics as brain implants, the root causes of the opioid crisis, and its dangers to the public, the war on drugs in general and its effects on society, and possible solutions to these problems. We hope you find these lessons helpful, and want you to know that you can send us feedback and reach out to us with questions. Remember that this is an educational channel, where we will help you understand the science of addiction. We will not diagnose or treat any medical condition in this forum. We can help guide you to resources like physicians and nurse practitioners near you that will be able to help you with treatment options if that's something you need. Our goal is to help you better understand the science behind this condition. Whether you are a medical professional, social worker, law enforcement officer, or a seeker of knowledge in general. Remember to always protect your privacy if asking questions in these classes, and do not reveal anything personal in a public forum that you don't want others to see, especially anything regarding your personal health. One-on-one tutoring on the science of addiction may be available through our Patreon links if you need more help with any concept or lesson. If you want to support this channel, please join us on Patreon at patreon.com/Terran Academy of Science. There will be a link in the description. Thanks for listening, and stay safe.